Well, my experience is physiotherapy is key, actually, following joint surgery. I've had the chance myself, or the mischance, to have hip surgery in the past, and so I can probably give you a little bit more information about this. There's a lot of misconception about what should be done and what should be done, so I guess today we'll try to clarify that together. My name is Patrick Enfield. I'm the head physiotherapist here at Action Sport Physio and also the owner. I've been practicing for the last 40 years as a physiotherapist. Misconception number one: is physiotherapy optional after joint replacement? The answer is it's mandatory, really. My experience with joint replacement is there's two key to successful rehabs. The first one is the quality of the surgeon and how the job is being done. And the second part is making sure that you do your exercise from the beginning till the end and making sure that you're becoming as functional as possible. Misconception number two is physiotherapy should only start after the healing period, so after 2 weeks post-surgery. Again, this is false. Physiotherapy starts actually prior to surgery. We like to call people at least a few weeks before to inform them and let them know what to expect and give them some exercise to do to prepare them for surgery. Then we see people on surgical day to make sure they're functional. They start with day one with exercises to do to make sure that you do muscle activation. That tends to be, the muscles tend to fall asleep after surgery. The message doesn't go as well, so we want to make sure that we improve people from the get-go. Misconception number three: pain during physiotherapy means that it's not working. Again, that's false. I mean, after a major joint replacement, having pain is absolutely normal to some extent. We have to manage the pain, and we need to determine what pain is related to the joint itself versus muscle activity. Misconception number four: physiotherapy is not necessary with older patients. It's a misconception. I think it's necessary. We spend a lot more time with the elderly explaining to them a little bit more how to activate the muscle properly. They've been waiting for a fair long time to get surgery, so they tend to get weak, a little bit more atrophied, so they do definitely need the exercise. Misconception number five: once patients are home, they can continue their exercise without guidance. Typically, when we send patient home with an exercise program, these exercises are good for the first couple of weeks. Every week, these exercise needs to be modified according to the level of the patient. So that's why the program is tailor-made to every single patient in general. Misconception number six: physiotherapy is not necessary after the initial recovery. It is true in some of the cases where once the rehab is done, it's done. But for a lot of the patients, they want to have a follow-up later on to analyze where they are because level of function will change throughout the year. So we frequently see people 6 months after their recovery just to get a spot check on how they're doing. Or sometimes we do an online session with people living outside fairly far from here so we can address a new exercise program with them. In closing, I've had the chance to have a joint replacement myself, and I found the key for a full rehab, a successful rehab, is to make sure that you're disciplined through your exercise program, that you're disciplined through the follow-ups, and that you're making sure that you're actually closing the deal. You're going till the end of your rehab in order for you to have the most success. You're investing a lot of money into a joint replacement, so spending a few sessions in physiotherapy, making sure that you get the best optimal care to me is critical. And it's much easier to do regular follow-ups right after surgery than seeing people 3 or 4 months later when problem arise and now we have to go backward in order to improve things. So my suggestion would be to make sure that you are taken charge by a professional from the get-go, and you make sure that you follow these people until the end of your rehab.